Welcome to Oxwide, our Trust News Roundup. Greenwich Joint Emergency Team, or JET as they're known, is an example of a truly integrated health and social care service. We visited JET along with Council Leader Danny Thorpe at the Woolwich Centre to hear how they're providing great out-of-hospital care. So Jo, could you tell us exactly what JET stands for and what the service does?
So we're the Joint Emergency Team. We're a multidisciplinary crisis intervention team. Basically going out to see people within 2 hours of being referred in if it's an absolute crisis. Those that aren't as urgent, we will see them within 24 hours.
And is this for physical health?
It is for physical health, yeah. So the team's made up of social care staff, nurses, occupational therapists and physiotherapists, and we also have a handyman that works with us and GPs that work with us, and so it's 7 days a week, 8 till 8:30.
Can you tell us how this works in terms of the partnership that you've got?
Yeah, so the team is an integrated team, so we have a strong partnership with Royal Borough of Greenwich, but currently we're also working with the London Ambulance Service and 111 to increase our referrals to the 2-hour urgent crisis response. So we have been working with them to speed up the pathway, listening to calls to improve the quality of the pathway from 111 or LAS to us so that we can work with patients in their own home and they have a better outcome there.
Firstly, if there are any advantages of the partnership, and what are they?
I mean, there's huge advantages, I think, in terms of fundamentally for the resident that's in receipt of the service, because they're getting that integration between health and social care through a visit. You're getting staff who are able to do things on behalf of health and social care regardless of their professional background, and that's come through the way the team's integrated, the way the team's trained and supported. So you may have social workers, taking bloods, you may have health staff putting in care packages, and it's really, I think, heralding some of the policy changes that are coming down the line from government in terms of integration going forward.
Can you tell us what range of services the JET team offer to patients?
So we will undertake functional and mobility assessments, any social care crisis that there might be, emergency placements, safeguarding issues that need crisis intervention to keep that person safe, any nursing intervention that's required. And we use the transdisciplinary model, which enables all of our health and social care professionals to work outside of their professional boundaries, which enables them to look at all the aspects of a person's care needs or social care needs.
So you've come to spend the afternoon with JET in Greenwich. Can you tell us what you've found so far, what you found out?
So I'm here for the afternoon with the JET team, looking at the work we're doing as an integrated group of people to support residents across Greenwich. So far I've seen some of the discussions about caseload, provision that we're providing to residents in need, and looking at how we're bringing different people together from different disciplines to really give the best possible outcomes for our population.
Are you spending the afternoon with the team?
Yeah, so I'm spending the afternoon here. I'll be also out visiting patients who are receiving care, and clearly making sure that we have a home first approach is really important, because we don't want people going to hospital unless we need them to absolutely be there. But equally, the way that we have treated people, particularly through COVID, and kept people at home, potentially offers lessons for all of us beyond the pandemic. So it's going to be fantastic to see some of that work in action.
Would you say it's about great out-of-hospital care in a sense, so keeping people out of hospital in their homes?
Yeah, absolutely. Yeah, I mean, I think as a partnership we fundamentally focused on delivering a home first objective, and that applies not only to when people come out from hospital but also to prevent people having to need to go into hospital. So absolutely would identify with that.
So I would say the JET team is a great example of integrated care. We're working from both health and social care perspective to support patients at home, because we know home is the best place for people to recover.
Now, providing the best patient care means keeping our iPads up to date. But what happens to the old equipment? where we met with Charlton Athletic Community Trust to find out. Can you tell us why we're here today?
Yes, so we do a number of initiatives with Charlton. We've been invited to do the NHS football, and we've come up with a solution that we can work with Charlton Athletic Community Trust to donate some of the Trust's old iPad equipment out into their community services to support programmes and mental health initiatives.
Oxleas are here today to donate several hundred iPads to the Trust. Can you tell us the sort of benefits that will have?
Well, this sort of gift in kind is a tremendous benefit to us financially. It will allow us to spend more on the delivery of our programmes because we won't have to spend on this equipment. We'll just have more funding available to spend on our programmes in the community. So it's going to be massively beneficial to us.
So what exactly is the Post-16 Football and Education Academy?
So it's an education programme that combines football and education. So the boys do half their day on the football pitch and half their day in the classroom doing a sports diploma.
Young Greenwich is a partnership between CACT, Metro and Oxleas, where we deliver services basically from 5-year-olds up to 19 or up to 25 if they've got special education needs or disabilities.
Why are we here today?
So we're receiving some iPads which are going to go to the students, which is really going to help them support in terms of their assignments and their classwork, because these students don't always have access to IT. So they'll be able to use the iPads to do classwork, assignments, projects, and it will really support them with the programme.
The benefits will be amazing to the young people, and I think especially during the lockdown and the pandemic it highlighted that a lot of families do not have technology at home and people were struggling to do their schoolwork. So for us, we can donate to some of those families. We can provide space because a lot of young people don't have the space indoors to be able to do their homework, so we can provide the space. We've got limited resources at the moment, so they have to share, a laptop between 2 or 3 of them. So with these iPads we can do the homework clubs, we can increase our education offer to more young people so they can come in because they'll have an iPad to work on. They can do research, sometimes we'll go out and we'll do research, maybe around Black History Month or International Women's Day. They can take part in that. It'll be amazing for them, absolutely amazing.
Does that make a big difference to them? Make it easier for them to be more mobile with their learning?
Massively. Because some of these students, like I said, won't have access to IT at home, so they can take them home, use them to do their coursework. Also, instead of being in the classroom, having to learn on their phone at times, they'll be able to use the iPad, which would be a massively important part of improving their delivery of work and assignments.
There'll be benefits across a number of our different programmes, for example the youth service, our education programmes, the NCS programme where we work with young people in the school holidays. So yes, across the breadth of the whole of the Trust's activities there'll be a benefit there.
So the partnership between Oxleas and Charlton is a brilliant one. I've been involved for 15 years with Oxleas and we've done some great projects together. Mental health projects that obviously are funded by Oxleas, but there's a lot of other joint work that we do. I think we've got a similar ethos in terms of our care for the people we work with. There's a passion within the teams that I've worked with Oxleas, and it's great to do this bit of work with Nick as well, and we'll be making sure that these iPads and technology go out to partners and families that will really benefit from the use of them, so it's much appreciated.
This was your idea, I think, wasn't it, to donate them here?
Yeah, so yes, kind of. I don't take much credit for it, but obviously I've spent some time with Carl when we've done the football, and we've done some work in the schools that we partner with, and obviously it's just a natural progression for us to then work with Charlton again, as we have such a good rapport with them. The Trust themselves have worked with Charlton for a number of years running all these programmes, and it just seems the right thing to do.
And finally, local MP Louie French visited our staff at Queen Mary's Hospital to thank them in person for all their efforts, and also officially open our new crisis line service. So welcome to Queen Mary's, Louie.
Thank you for having me, it's been brilliant.
And so what have your impressions been of visiting the hospital today?
Well, it's great to be back at Queen Mary's Sidcup. This is a fantastic local community hospital. To see everyone working so hard, really taking into the care of patients, which is so important. And looking at how teams are moving on, hopefully in a post-COVID environment, and learning to live with a new normal.
And have you been able to see partnership in action here today.
Yes, it's really noticeable, obviously, with different trusts that work on site. Actually, you can see, within wards, different services, actually people, like I said, are working closely together, which is great, particularly for patients that don't get, messed around, that might be the case in other areas. Actually, here at Queen Mary's, everyone's working together in really good partnership.
And if you had a message for Oxleas staff after the last 2 years of the pandemic, what would that be?
Well, that would be thank you, a massive thank you from everyone, across the community of Old Bexley and Sidcup. The area that I'm proud to represent. We value so much the work that Oxleas does, in this borough in Bexley, but also in other boroughs. It's been, no doubt how much effort and time and dedication they've given to look after people in the most testing of circumstances with COVID. That's why I said I'm hoping that we are moving on, hopefully, from the worst of COVID. But it really is just a message of thank you, and you are real, frontline heroes to all of us.
So how would you like to see Queen Mary's develop for local people?
Well, I think it's about delivering more services here. I think that's what's so vital, not having to travel into central London, for example, being able to have access to services here in Sidcup, great access routes across to the A20 and the rest of Bexley. In particular, I'm really keen to see community diagnostics and the expansion of that on site. I think Queen Mary's has the potential to do that, and the will, which is fantastic. So that's my real kind of lobbying focus of government, is actually try and deliver community diagnostics here at Queen Mary's to expand services so actually patient outcomes are even better, and it supports the trust with their significant backlogs as well.
And you officially opened our crisis call centre today. Why do you think that service is so important?
Well, it was a great honour to open and to cut the ribbon in the crisis call centre today, and fantastic cake, I must say, that was on offer. It's a vital service. We've all had our own mental health challenges, particularly due to lockdowns, affecting people of all different ages and backgrounds. So that kind of call centre will do such a fantastic frontline work for people that are in real need. And like a lot what Oxleas does, it's that great focus on mental health, and then the kind of relationships that has with physical health as well. So that I'm no doubt that call centre and the team there, the brilliant team that are working together, are going to do really important work for the community.
So after James Brokenshire's very sad and premature passing, how do you hope to continue the legacy that he's left?
James was a fantastic man, and he was a fantastic champion of Queen Mary's Hospital. A good friend of mine, dearly lost by all of us. I think with James's own kind of health battles, I think actually, linking in the community diagnostics and some of those missed operations and missed tests that people have been through, I think James's legacy will live on naturally because people are aware of his own tragic, end of life, and the battle he had with cancer and lung cancer in particular. I think my personal aspirations are, like I said, to deliver more services here at Queen Mary's. James, when he first became our MP, fought so hard along other local people to keep the hospital in some formation. My challenge is to build on that and actually to get more services built on Queen Mary's, alongside other local issues that James was campaigning extremely hard on. For example, we've got a new train that is named in James's honour that runs on the Sidcup line, and you'll see his name on the front of the train. So he's already delivering, even after he sadly left us. But big shoes to fill. But it's a huge honour to represent my local area and to continue my great friend's work.
That's it for today. We hope you enjoyed it. Don't forget to drop us a line with your suggestions, and we'll see you soon.